Good day. My name is Michelle Lavander. I'm the director of the USC Center for Health Journalism. Thanks for joining us today for our Health Matters webinar, Is Social Media Fueling the Youth Mental Health Crisis? This webinar explores the research and the journalism aimed at answering a fundamental question of our times. Is social media driving the alarming increase in depression, anxiety, suicide, and other mental health struggles among young people? The U.S. Surgeon General noted this year that social media can be a source of connection for youth who are marginalized, such as LGBTQ plus teens and those with disabilities. But children and adolescents who overwhelmingly are on social media for hours a day only too easily encounter sexual and violent content, bullying, body shaming, and bigotry on popular platforms, the Surgeon General warned. Other sectors of society are taking note as well. This year, 42 state attorneys general sued Meta, the owner of Facebook and Instagram. They accused the company of manipulative practices that lead some youth to become addicted to its platforms, raising the risk of mental illness during a vulnerable period of brain development. Here to help us understand the research and the controversies, to explore fresh reporting angles, and the sometimes positive impacts of social media for some marginalized youth, we have three distinguished panelists. Linda Sharmaraman is a senior research scientist at the Wesley Centers for Women. She's founder and director of the Youth Media and Wellbeing Research Lab. She co-authored a recent American Psychological Association advisory on social media and youth. Jeff Horowitz is a technology reporter for the Wall Street Journal in San Francisco, where he covers Meta and social media platforms. He's the author of Broken Code: Inside Facebook and the Fight to Expose Its Harmful Secrets, which was published in November. His reporting for the journal's investigative series, The Facebook Files, has won numerous awards. Jean Twenge is a professor of psychology at San Diego State University and the author of more than 180 scientific publications and 7 books, including iGen: Why Today's Super-Connected Kids Are Growing Up Less Rebellious, More Tolerant, Less Happy, and Completely Unprepared for Adulthood. She served as a consultant on the Attorney General lawsuit against Meta. This webinar is made possible thanks to the generous support of the Christy Hammond Fund for Health Journalism. We'll be archiving this conversation later today at centerforhealthjournalism.org. A word about our format: we'll be hearing from our speakers first, and then we'll turn it over to our audience for questions. Feel free to share general comments in the chat. Because we have many people joining us on Zoom, we'll ask you to write your questions for our speakers into the Q&A panel. You can also write us there if you're experiencing technical problems. Now let's get underway. Jean, you have been sounding the alarm for years about the effects of smartphones and digital media on the mental health of young people, and you served as a consultant for the Attorney General lawsuit. Please walk us through some of the core ideas of your research.
Absolutely, happy to, and thank you so much for inviting me. So that is the cover of iGen, which, as you noticed when you were reading it earlier, Michelle, has the world's longest subtitle, just because there's so many interesting trends to discuss with that group. And then my most recent book is about all 6 living American generations and how technology in all of its forms has had an impact on us. So I'm going to go through some of the evidence linking social media use with mental health. And forgive me, I'm going to go fairly fast. So the first piece is, how have things changed over time? So I've been doing this work on generational differences for a long time. And I get used to seeing changes that were big, but they take a decade or two to get there. Then about 10 or 12 years ago, I started to see changes that were bigger and more sudden. I had really never seen anything like it. For example, more and more teens started to say that they felt left out. More and more started to say that they felt lonely. More started to say they felt like they couldn't do anything right, that their life wasn't useful, that they didn't enjoy life. And these are classic symptoms of depression. We see these same patterns in these items across racial and ethnic groups. fairly identical with the increases beginning around 2012. We also see the same based on socioeconomic status. So the less advantaged kids and the more advantaged kids, the pattern again, very similar. We see this in more serious issues like major depressive episodes. So that's depression that really requires treatment. That doubled among 12 to 17-year-olds between 2011 and 2019. So before the pandemic. You've probably all heard about the adolescent mental health crisis. In the same breath, many people say it must be due to the pandemic. It got started about 8 years before the pandemic and continued from there. It's also quite severe in 18 to 25-year-old young adults. And this is a screening study. These are not people going to the doctor or seeking help, so we can't explain it away by that. This is a cross-section of the population. Could it just be that people are more willing to admit to symptoms? If that were the case, we would expect to not see any changes in behaviors that can be objectively measured, like emergency room admissions for self-harm behaviors. Those have doubled among 15 to 19-year-old girls and young women, and they have increased by a factor of 5 among 10 to 14-year-old girls who think about this age group are in 4th grade through 9th grade, and that is increased by a factor of 5. The suicide rate for these age groups has also doubled over this time, and that cannot be attributed to self-report. So here's the question: what happened? What happened around 2012 and the early 2010s that could be causing this? That was the question I had when I first started to see these trends. And at first I had absolutely no idea. It was a mystery. It didn't line up with economic trends. The economy was finally starting to improve after the Great Recession around 2011 or 2012. It was tough to think of any event that happened in 2012 then that kept going across the decade. And then one day I came across a poll from the Pew Center for Research, and things started to fall into place, because what happened at the end of 2012 was this happened. That was the first year that the majority of Americans owned a smartphone. There were also some key changes in social media. 2012 is the year that Facebook bought Instagram. It's when smartphones started to get front-facing cameras. It's also when, across demographic groups, social media use moved from something that about half of teens were doing every day to something almost all of them were doing every day, with arguably an inflection point, again, in the early 2010s, when 50% are doing something fairly optional. It gets past 70, 75% in a teen population, then it becomes virtually mandatory. So here's how it looks. That's the increase in clinical level depression. That's the trend in social media use, the time that teens spend online. They increase in lockstep. What doesn't fit at all and actually goes in the opposite direction is economic indicators like unemployment. You'd think depression would be going down at a time when unemployment was going down and the economy was getting better. Instead, it's the opposite. But what does line up is these changes in technology. We also see these trends, virtually identical trends around the world, in anxiety, in loneliness at school, and in some cases also in self-harm and suicide. That helps rule out more US-specific alternative explanations around political events or school shootings or any of those things when we see these virtually identical trends around the world. It's not just the time sequence, it's also that the rise of these technologies was by far the largest change in teens' lives after 2012. It wasn't an event they read about. It wasn't something that happened to their parents. It was something that had an impact on their day-to-day lives for hours and hours a day over this time. Nothing else really fits the pattern. I did a Substack recently, 13 other alternative explanations, and they all fall apart under scrutiny. What about among individuals? Is there a link between the amount of time a teen spends on social media and how likely it is he or she is to be depressed or unhappy? Here's a study using data from the UK. Among girls, those who are on social media 5 or more hours a day, 3 times more likely to have clinically relevant levels of depression than those who don't use social media. More shallow for boys, but with the end result that heavy users still twice as likely to have clinically relevant levels of depression than lower users. We see these same patterns across socioeconomic status, more advantaged kids and less advantaged kids. The pattern is very similar. There's not a huge difference here, that the longer a teen is on social media, the more likely it is he or she is unhappy. We can also see a similar pattern across race and ethnicity for the link between hours per day on electronic devices and risk factors for suicide like depression and suicidal thoughts, that these patterns look very similar across these groups. One thing that does make a difference is age. The link between social media use and well-being, compromised well-being, is bigger at younger ages. So this is from a paper that breaks that down. And for girls in particular, that's those red lines at ages 11, 12, 13, 14, 15. That's where you see the biggest link between social media use, heavy social media use, and very low well-being. So are these effects, these links, big enough to matter? That's where it gets a little complicated, where most analyses find, it's called a linear correlation, 0.1 to 0.2. A lot of psychologists have said those are small, not really big enough to matter. But that same R translates to what I showed you across studies. Somewhere between 50% to 200% more depressed among heavy users versus light, which I can't see how anyone could describe that as small when you have 3 times as many who are depressed or twice as many who are depressed, even 75% more who are depressed among heavy users versus light. Those types of statistics are more often used in medicine and public health. I think this is one of the biggest reasons why sometimes this research literature is described as, quote, mixed, because it depends on what statistic people are using. But this is the same data using the same population, same measures. It just depends on what stat you're using. So psychologists are dismissing these correlations as small. Medicine and public health, when they put it in terms of that relative risk of percentages, doesn't seem small anymore. A lot of the meta-analyses, studies of studies up to this point, have used R. There's a recent one that uses this percentage increase in risk, and it found a 13% increase in risk with each hour of social media use. You add that up, it means you go from 0 to 7 hours a day, close to a doubling in risk, very similar to some of these individual studies, even if you stick with linear R. That red bar is the correlation, the R, between social media and mental health in that UK study. The blue bar is the linear R between childhood lead exposure and adult IQ. It's about half the size. Most people agree that that's something that matters. So in these correlational studies, what causes what? Is it depressed kids spend more time on social media? Social media use leads to more depression. Hard to separate in that type of data. So there's been some experiments in this area. They can show causation because they randomly assign people to have different experiences. There was one that randomly assigned people to deactivate Facebook versus not, and then measured mental health. And after 4 weeks, those who had deactivated their accounts, higher life satisfaction, less anxiety, less depression, and were happier. Another asked college students to simply cut back on their social media use. They didn't think it was realistic to ask them to give it up completely. And those who cut back, their depression declined from the initial measurement. Even more interesting, that decline was considerably larger in that right-hand category of those who were already high in depression. Their depression got cut more after they minimized their social media use. So this is just some of the data for why I think that the increase in teen depression was at least partially, probably primarily caused by the rise of smartphones and social media. So what can we do about that? A couple of common sense solutions. No phones during the school day, bell to bell. That's not, of course, just for mental health. It's also for learning. If you followed some of the recent findings from the worldwide PISA study with huge declines in math, reading, and science performance since 2012, right at the same time these technologies were growing. We should raise the minimum age for social media to 16. Right now it's 13, but it's not enforced because age isn't verified. Routinely, 8, 9, 10-year-old kids on TikTok, even Instagram. Yet we see the strongest link to depression among the youngest teens. And right now you don't need parental permission to open a social media account. And can you think of another contract that people can sign when they're not 18 yet all of their data freely accessible to the social media companies, plus all of these other challenges that we have been discussing. And then my number one is this: no matter what age you are, don't have your phone in your bedroom overnight, because we know from sleep lab studies that you will not sleep as well if that phone's on your bedside table. Now, the question a lot of people have is, wait, I have to have my phone in my bedroom overnight because it's my alarm clock. I have some advice for you. Buy an alarm clock. You can buy it on Amazon on your phone and then put your phone away and get a good night's sleep. Thank you.
Thank you, Jean, and thank you for the alarm clock advice too. A quick follow-up for the journalists in our audience who are maybe not regularly looking at scientific studies. You point out all these correlations between the rise of smartphones and increases in mental health problems. Health journalists and just journals in general are always sensitive to the fact that correlation isn't necessarily causation. So could you walk us through those distinctions in the context of even the kind of wording that a journalist might use to explain the research that you're doing?
Right. So those correlational studies that I showed, that's certainly something we have to keep in mind, that it could be the depressed kids are using social media more rather than social media leading to depression. We have enough experimental data now, and most of it does show effects that, particularly most of the designs are that people cut back or give up social media, and then they look at outcomes. Now, if you look at the outcomes the next day or even a week later, they might not be great because people have withdrawal symptoms. But if you look 3 weeks, a month later, once people have gotten used to that, that's where those experiments tend to show more happiness, less depression. The other thing that I want to point out is that time series data that I began with also really argues against the idea that it's depression leading to social media use. Because if that's what was going on, you would have to say this. You'd have to say, okay, teen depression increased for some completely unknown reason nobody's been able to figure out yet over 10 years. And that's why teens spent more time on social media and started buying smartphones. It doesn't make a whole lot of sense. I mean, it seems much more likely we had these changes in technology use and then depression followed. And we were able to look at that time sequence in some data. That's exactly what we found.
Thank you. And Jeff, let's turn to you now. Your Facebook file series in the Wall Street Journal exposed what the company's hidden internal research showed about the risks to young users. Tell us about how that series came to be and what your investigation revealed about the mechanics of these popular platforms and how the algorithms can make them problematic, especially for vulnerable teens.
Sure. I mean, those The Facebook files came to be because someone gave me a ton of documents. I worked with that person, Frances Haugen, for a number of months, and eventually, 20,000 plus internal screenshots came to be. And for anyone who wants to talk about security and all of those things, please contact me offline. That's seems sort of tangential to this thing. I'm happy to discuss managing information coming out. But I think what I was hoping I could focus on is a couple of things. First is just kind of the overall framework for approaching this stuff. Well, actually, is what the company sort of has internally concluded. Then is sort of what the framework that a reporter should approach these same issues with when thinking about them. And I think there has been a lot of discussion of social media use being a moral panic. People rightly, roll out, old op-eds about the rise of the novel corrupting children, the rise of jazz corrupting the children, the rise of radio, etc. And yes, every time there is a new technology that arrives for mass communication, there are concerns about it. That doesn't mean that the concerns are invalid. I think, the analogy I think I would probably most want to draw would be, say, the telephone or television, right? Is the telephone good? Absolutely, right? Very useful. People can call it. It can be used in good and bad ways. Television, likewise. Like, I've learned a lot on PBS. I have also consumed total trash at 2 PM, and that's not been good for me. And so the question is, what is the usage? What is the design feature? What are the traits of being used? And I think something that's really interesting about Dr. Twangy's timeline here is that 2012 is also roughly when we start switching to a recommendation driven system for content. The idea that social media is sort of a static thing that we can say whether it is good or bad as a net, I think is like kind of ridiculous. It's like, is TV good or bad? Like, no, let's just not do that. The question is, how is it being used? How is it being designed? And then you sort of make decisions on that. So now in terms of the internal stuff, just a very brief run through of what is in Meta's own documents. And I'm going to be very sort of shorthand here. First one is that arriving at social media when you are in a bad state of mind is not good for you. We all know this actually from our own use of social media. You will be able to verify that from personal experience. But kids who arrive vulnerable don't do well. The second one is that self-control and teaching self-control does not work. That is, per the people inside the company, basically an offloading of responsibility onto young users. It turns out that the people who are most in need of stopping, which is to say people who say this thing's actively harming my health, they don't stop. That is I'm not saying that you can't perhaps train yourself out of that, but the idea that sort of like, consumer education is a solution, that's not what the company itself is aware of. The second one is that recommendation systems exacerbate the problem content consumption of both youth and adults. Whatever a person would consume if they were just sort of, browsing their friends' posts, they will consume worse stuff when it's recommendation driven. That is just kind of a persistent thing. Next one, beauty filters are awful. They are bad for both the person who is posting the content and the person who is consuming the content. The person who's posting is like, I know I'm not this pretty. The person who's consuming the content doesn't know the person's not that pretty and is comparing themselves to a person who's fantastically good looking. And then final one, I think, would be notifications are terrible, right? Like, basically actively pushing alerts to kids is something that there are a lot of qualms about internally at companies, at Meta in particular, because this just kind of kicks off unhealthy usage. And I think that, something that the social media companies and perhaps Meta in particular have really relied on is the idea that there are benefits, right? That talking to your friends is good for you. Shocker, right? And people do talk to their friends via Instagram. They stay in touch. They learn about things. These are good things. But again, back to that TV model, I think it's reasonable to assume that if you're designing something that looks and feels like PBS, it's going to be different than if you're designing something that looks and feels like Jerry Springer, to use a dated TV reference. So yeah, I think, and in terms of sort of what the companies themselves say, I would highly recommend, at least for anyone covering Meta, whenever there is a statement from Meta about what the company believes about its products, please go check that out against the quotes from senior executives that were included in the lawsuits by Massachusetts and the federal lawsuit that's filed in California regarding teen mental health. Candidly, they are their own harshest critics. I mean, you will have their head of public policy for Instagram talking about how the platform was just designed in a way that is truly unfortunate for young teens. It was never built for young teens, and it's not good for them. You have, sort of acknowledgements of, I think, a lot of the things that the company hasn't perhaps wanted to acknowledge publicly. And I think something that Dr. Twenge was saying that resonates is the idea of like, well, can you prove it's the primary cause? That is something that even internally, the company has not been able to do. I think that, the question sort of should be is where does logic take you? What is the company's best understanding, as opposed to, like, can we conclusively prove that I am a better or worse human being because TV existed in my life, right? That's like, you're never going to get there. So in terms of just reporting this stuff, one, there is a lot of expertise out there now. The Integrity Institute is one organization that has a lot of people who have left a whole bunch of different platforms, not just Meta's, and are very happy to share mechanics and sort of some of the social science research that was happening internally. Another thing, though, that is absolutely doable and that is, I think, deeply underused and is sort of the core of some of the recent work I'm doing on child safety and, basically protection from predators' scents, is just set up some test accounts. If you're curious about Instagram and mental health, go follow a certain group of go set up a few different accounts. Instagram lets you set up 5 at once if you feel like it, simultaneously. Follow different sets of users. Follow some beauty influencers. Follow some sports figures. And then see what the platform gives you. Maybe even search for accounts that seem to be promoting eating disorder content. It is sadly not hard. And I will say that once you find yourself in there, look at who the suggested for you accounts suddenly turn to, and judge for yourself whether Instagram has successfully, as the company has said it does, managed to prevent people spiraling into eating disorder content. So there's a lot of kind of first-party experimental research. Again, this is not, I'm not trying to publish this in Science, but just in terms of directional, what is the platform ultimately doing? There's a lot you can do there.
Thank you, Jeff. And we're going to turn now to Linda. You've looked at the ways youth of color, LGBTQ youth, and other marginalized populations use social media, offering a somewhat different picture of its impact. You also co-authored the recent American Psychological Association advisory on social media use by adolescents, which takes a more youth empowerment emphasis than the Surgeon General's report and the Attorney's General lawsuit. So tell us about your research, the APA report, and the basis for its conclusions.
You're muted.
I just realized I was muted. Thank you so much for inviting me to this wonderful panel. I invite you all to kind of think about a different alternative to what people are discussing today. New perspectives that our lab often tries to kind of focus on overlooked populations using the same types of technologies that all of us have been talking about today. And as you had mentioned, I was part of the task force that co-wrote the APA advisory. And I wanted to focus, even though there's a lot of points, there's 10 points in the advisory, I wanted to focus on some that are often overlooked by journalists, I'd have to say. Like, for instance, the fact that social media isn't inherently good or bad, and that it really depends on what you're doing, what you're seeing, what are your strengths and vulnerabilities, and the context in which you grow up in. Do you have supervision? Do you have guidance? Do you have peer support or peer neglect? It really depends. And another thing that we mentioned in our advisory is that sometimes even people with mental health difficulties could also practice some of their reaching out and social networking skills to try to help ameliorate some of those feelings of social isolation and loneliness. And that's something that a lot of people would not hear in the media. Looking at the Pew Research results that happen, for many, many years now, they have been finding that most teens are doing fine on social media. Most of them have predominantly positive experiences. And there are, of course, negative experiences that people, experience. And in fact, it's the same people. The same people are feeling more connected to their lives, but also there's drama. And sometimes some of them feel more, worse about their own life after being on social media. But if you look at it overall of all US teens, it's more like a fifth of them are feeling that way. And so what I wanted to say is that if stakeholders are trying to figure out what direction they should go into help supporting young people's well-being, is it more important to encourage the positive use, or is it more important to prevent negative use? And the answer is probably both. Everybody has to kind of be putting their effort into both sides of the spectrum and not ignoring that there's certain ways that young people are experiencing social media that might not be the average, kind of use. So the Surgeon General also mentioned in another advisory before this social media one about the public health concern of loneliness, and that it actually is equal to 15 cigarettes a day. That social connection is so important that it could lead to premature death. And remember that social media, by definition, is supposed to be social. And so encouraging passive use or non-interaction can actually increase FOMO, social isolation, and alienation. So I want to highlight that there's this chapter that's in this open access book, Adolescent Digital Media Use and Mental Health, that I wrote with some co-authors about marginalized youth using this, that was also cited in the Surgeon General's advisory recently, that tells a picture of both the positive and negative aspects of social media in the form of identity. Yes, there is the part where there's cyber harassment and more risk of anxiety on social media for maybe youth of color and LGBT. Also, though, the other side of that equation is that there's also a space of empowerment and exploring one's identity and increasing your social capital and finding a sense of belonging. When we look at how Black, Latinx, and LGBT youth are using social media in different ways compared to their counterparts, they are more likely to join online groups to reduce social isolation, whereas Asian American youth are least likely. And also LGBT youth report that their online friends are even more supportive sometimes than their offline friends. Maybe they're more out to their online friends as well. And this brings me to the idea that there's really no one-size-fits-all approach. The Surgeon General did mention that in his advisory that we should pay more attention to the experiences of marginalized and underserved youth. However, that was a very small section of the advisory, and that more needs to be done, and it's still unclear. Although some of the rising research at the moment does lead to the idea that there are definitely instances of racism and discrimination that we imagine are seeing in our feed, but also identity affirming content. There's also more body positivity movements, more people of different shapes and sizes on social media that you could see more images of yourself that may not have been around in mainstream media in the past. Now, who's marginalized? I wanted to kind of go over some often overlooked marginalized youth in this space, that people that are over 13 are actually in the minority of signing up for social media. Early adolescents are also underrepresented in social media studies, and most of it is on high school and college. So very little is known about the tweens and the younger teens. And despite the fact that adolescents of color are the most avid users of social media, they are the ones that are least likely to have a voice in the design of its features. Perpetrators of online harassment and mean comments, they need mental health resources too. A lot of people focus on the victims of the harassment, but also the perpetrators need help as well. And as I said before, most people are feeling more connected to other people on social media, and far fewer are feeling worse, but we care about all of them. Social context matters. LGBT youth face regional differences. If there are, more conservative, areas, rural areas that they actually need social media for their lifeline in order to actually have a safe space to be in. Young people of color in urban areas, sometimes actually the online space is more safe for their physical and mental well-being, and that's something that people often overlook. Neurodiverse youth and socially anxious youth sometimes think of the online world as something that in which they can explore other aspects of themselves and practice their social skills in ways that they can't do on the fly in real life. And also, not all youth have the same resources in their village. Not everybody has a traditional family structure in which they can actually supervise them in ways that, a standard, two-parent family, somebody who's going to school with peers, can do. Now, the conditions that promote marginalization are wide ranging, anywhere from the lack of nuance, in research headlines to academic publishing. It often prioritizes significant findings rather than null findings where there's really no association, that people don't often are able to publish those kinds of studies. And also there's a overemphasis on quantity over quality of time on screens, which is, I'm so excited about the future of our fields to look more at the context and content. And then also funding resources are also much more focused on risk over resilience. How do we prevent harm versus, and really find the best treatments for people who are already harmed, as opposed to improving the well-being and encouraging more positive use. Here are some examples of headlines or takeaway points in which one side is the protectionist stance, the other side is the empowerment stance. So one side, okay, yes, they're harassed online in everyday life as well, but also they can find online communities in which they can feel safe. Youth of color are more on screens, and 2 hours more on screens than their counterparts, white youth. However, you can also spin it to say, actually, social media is more enjoyable for youth of color, and they are social learners. Sometimes they are doing their homework while they're doing their social media and connecting with other people. And so these are just some ways in which people could have the youth empowerment lens, as opposed to just that youth really can't take care of themselves and they need a helicopter stance for people to feel safe for them on their behalf. Now, an advisory that a lot of people have not heard of and have not really been, promoting around is this new narrative from the American Academy of Pediatrics, in which they're trying to say that digital media use is developmentally appropriate. Adolescents should be pursuing developmental tasks such as identity exploration, that there's risks and benefits of digital media use for everybody of all ages, and that very little across all those big, correlational studies are explaining the impact of social media on mental well-being. And that sometimes the U-shaped curve, which means it's not a linear relationship, it's often the people that are extremes, the ones that are using it way too much, like the 14-hour people on games, versus the people that aren't on it at all and have cut off their means of communicating with other people, especially during the pandemic. They might have worse outcomes compared to the people that are in the middle and doing what their peers are doing and kind of being in the norm. And what they're trying to say in this new narrative is that a shame-based narrative about people being on phones or people being online, as if it's like necessarily a negative thing to be hiding. And one of my last slides is just looking towards the future. If you're thinking about ways to characterize, the state of our field, I mean, it goes, I just wanted to mention that, technology is rapidly changing, and even studies from 2-3 years ago, 5 years ago, 10 years ago, they are getting out of date quite quickly. Even high schoolers are mentioning how their middle school, younger siblings are using technologies in ways that they never even, imagined. And so the intergenerational differences between people using it is really hard to capture, when there's social media platforms that have changing features all the time, and it's really hard to have a blanket, kind of stance on social media in general. Really know your resources. Really look at the evidence that you're going to be, reporting, and think about the marginalized voice. And when you start making blanket statements about a monolithic adolescent population, when they really are many different subgroups that have varying ranges of vulnerabilities and strengths. And my last call is just to think about the youth as the future of our digital ecosystem, rather than people we need to shelter away, all the negative things that could happen. They need opportunities to exercise their social conflict skills also. They need opportunities to exercise their self-regulation skills, to learn through trial and error, through guidance from the village, of siblings and parents and educators and government, policymakers. They need to be able to have decision-making capacity. They need to be mindful about their own use, and that they can also co-design the future of this technology. So please consider youth participatory action, in all the research that you might, highlight, the ones that are caring about the youth voice, because they are the future of our digital ecosystem. Yep. And I happen to run a digital wellbeing workshop, because I do believe that the young people have an important voice to share in the design of these technologies. And so we promote self-awareness and awareness of other people on social media, how to protect their well-being. There's a free, resource for anybody in the country. And this past summer with our youth advisory board, they decided that this year we were going to focus on body image and AI. And they came up with amazing new ways to train their algorithms. They all knew that their algorithms are things that they could manipulate and that they could make more positive. And so they all had a brilliant, kind of suggestions and recommendations, in which we had an audience come to watch their final projects. So that's what our lab has been up to.
Thank you so much. Linda, we're going to open this up for questions from the folks listening to this presentation. But before we do that, Jeff, just in a nod to the journalists in our audience, if you were going to kind of look forward, what sorts of questions would you suggest folks explore who aren't about to get a trove of leaked documents, but who do want to cover this?
I think one thing that's pretty important, and I guess this is a little bit in reference to the last presentation, is looking at funding sources, and sort of where nonprofits are perhaps aligning in some instances with platforms. So, one of the things I think that we covered in the Facebook Files work was a lot of nonprofits, particularly those representing minority communities, are frequently receiving partnerships / consulting fees from platforms. And I think that's something that's always worth asking about. I do think that, at the moment we are getting into an environment where I think Meta is pushing very hard on the idea that the fact that the BRID products are most heavily used in minority communities indicates somehow is a clear indication of value to those users. In other words, more time equals more benefit. So that's just kind of a general framing. In terms of local stuff, I think it is a great thing to go ask kids with their parents' permission to take a look at what comes into their inboxes in terms of, the harassment versus support type issues that are being discussed. I think it's an excellent idea to go find local clinics that deal with eating disorder content or eating disorder and ask them about sort of what they suggest and why related to social media consumption. And also, I think just the question of I think this is something that I think we sort of broadly all agree on, but is what are the specific feature sets that you're writing about, and how does, if you're looking at a problem, let's say consumption of eating disorder content, how does a platform interact with that? Likewise, if you're looking at a solution, say, youth finding quality communities in which they're able to discuss their identities in good fashion. What does that actually look like? Go find it on the platform, wherever it is.
Thank you, Jeff. I'm going to just share some of the questions. We have one from Sunita Sorabji, who says, what about kids in the developing world who don't have access to technology? Although I would venture that a lot of them do, but are there studies comparing rates of depression and suicide?
Yes, we don't have a ton from a lot of developing nations, but we have data from the PISA survey on life satisfaction and loneliness at school among about 40 countries around the world, and the trend lines are virtually identical to what we see in the US, that there's very little change until 2012, and then those rates of loneliness and of anxiety shoot upward.
Thank you. We have a question from Jill Webb. She says, Jean mentioned that sometimes there are withdrawal symptoms when teens get off social media. What are those symptoms?
Well, I mean, this is something I haven't researched personally, but there's a lot of people who try to cut back on social media or who try to give it up. Just like Jeff mentioned, the company already knows that that doesn't work, and it doesn't work because it seems to mimic withdrawal, that you get these urges that you want to go back on it, and it is tough to handle.
It's great to look at the internal stuff. There are actually references to dopamine based, and again, they're throwing the word around a little casually. This is internal, but the idea of variable rewards, namely like kind of intermittent, almost like slot machine like payoffs in terms of something novel or exciting, turns out to be extremely effective at holding teen engagement. And while I think it's always a good idea to think about, for kids to think about their use, for parents to think about their kids' use, the very definitely internally there is an understanding that like I'm just thinking about one thing. This was the JED Foundation, was partnered with Meta on something, was talking about how, they were promoting posts that said like, I'm in control of my experience on Instagram. And it was like kind of sad to see, given that like the internal research being like, actually kids are not in control of their experience on Instagram.
By the way, everyone should feel free to chime in if they want to on these questions from our panel. We have a question from Sheila, who says, how can communities share info to protect youth on the verge of depression and suicidal ideation? And what are good ways to counter isolation? She goes on to say that she's heard that certain social media apps are now going to allow somebody to erase a message so there's no trail if the communication is linked to harm. And how do folks navigate that? I'm not sure if that's correct, but I'm sure Jeff will know.
That is correct. We're talking about Facebook Messenger here, and then the plan is to expand to Instagram later. It is both end-to-end encrypted, even for minors. So that means that an adult can contact a 14-year-old, and there will be military-grade encryption for that, which is a something new under the sun, particularly when paired with the discovery features. So that's something that, just in terms of being able to find people and get recommended content and then immediately duck into a fully encrypted forum, is something no major platform's previously done. And that was just last week.
So we have a question for Linda. Most parents and many youth on the west side of Chicago seem to believe social media sites are a major instigator of in-person violent feuds, including gun violence. Has this been studied, and what is the evidence for the statement that youth of color are the most avid users?
Yes, definitely there's online drama that happens, and the thing that it's not about the tool itself, it's about that peers are talking to other people, and it's publicly available information and archived. And so it's about the users and the way that they interact with each other. And if they choose to do it on social platforms versus like in person, that often is the reason why sometimes, the teachers and the principals have to kind of deal with some of the after effects of what happens, during the weekend. It's a blur boundary between the classroom walls and what happens in the home and in the neighborhood. And so, I mean, I think in general, if there's cyber harassment, and there's threat of personal safety, it really doesn't matter if there's guns involved. It's really about how do we manage, this kind of hate speech with young people, and to make sure that it doesn't, instigate, viral kind of reactions. In terms of the question about avid users, young people are like the kids of color are the ones that have kind of almost led a lot of movements, in terms of raising awareness about, marginalized issues. There's Black Twitter, and, people of color are the ones that started doing a lot more blogging back in the old days, before even like some of the micro blogging platforms came on, like Tumblr. And they're also online much more often, and use more platforms longer than the other ones. So they become more experts at them in a way. And I wanted to also mention a statement that Jeff had said earlier about how young people, the platforms don't believe that they have any control. People's perceptions about their agency really matters. And so even if like there's a puppet that's like, really actually masterminding some things, people have influence. There is influence in the way that they type in the search terms. They have influence in terms of who they put into their network. There's definitely ways in which they have some power. It doesn't mean that they have full control and full power, but the idea that the user has some agency and control over their online environment is an important thing to know, especially for young people.
I guess I would respond to that by saying that yes, obviously, we all have choices in how we approach things. However, the research on this internally does seem to suggest that the people who are most at risk of it are the ones who have the hardest time stopping. One other thing that you mentioned there, which is that the issue of drama, as you called it, is sort of not that's just a thing that happens, and it happens online too. I would disagree with that and suggest that this is something I think that if you're covering, say, a violent feud that has a root in social media, look at the view counts on the posts that preceded that. One thing that the platform, which is just, this is very simple, straightforward engagement-based mechanics, is that the platform will begin recommending high engagement content, and there is nothing higher engagement than a fight. If one kid getting decked at in a school parking lot starts going viral, that's something that I think can have a real impact. So I would dispute that this is just a thing that is just like, oh, well, that's a thing that happens online and offline. There are direct mechanic questions that at least arise in there.
Well, the type of,
sorry, go ahead, Linda.
I'm sorry, but the type of guidance that you would get from educators and parents to resolve these conflicts are the same for whether it's online or offline in a way.
No, but whether the content in which there is a beef is getting heavily promoted by the platform, that is something that is not a question of, yes, conflict resolution is a good thing, but the question of what the platform's role is there. Does that make sense?
Does make sense, but also algorithms can be trained to be promoting positive, sides too. It's not just always necessarily promoting the most malicious content.
What examples would you cite of that in terms of
like body positivity? Like, for instance, if somebody is typing in things like diet, fitspiration, that kind of thing, eating disorders, thin thighs, then algorithms could promote, oh, more body acceptance, body diversity,
Are there any, I mean, this is a sincere question. Are there any platforms that you're aware of that have actually done that in a way where it seems like that is out? I mean, because for example, if I type in skinny legs, hashtag skinny legs, I'm going to get a bunch of pretty awful recommendations, and then it's going to recommend other hashtags to me. I guess my question is there any, and I'm thinking here of I'm truly asking this because I cover one company's platforms. It may actually be different elsewhere. Is there anyone that you think is worth looking at as an example of building something that is robustly, clearly heading in a good direction?
Well, I think that if these departments that really take care of young people's well-being can be more, robustly funded, I think a lot of these departments are often the underfunded and overlooked and kind of, oh, we have this as a token department to try to, attack this. I just think that that all I know is that my students have told me, and the research I've been doing over the many years about how much they are able to find the content that they want, and that if they realize and they're mindful about, oh, it's going down the wrong rabbit hole, I'm going to start curating things and only looking at things that I want to see and that will be good for my well-being. Those the experiences that they're starting to see more so than in before, when it just felt like, oh, how did I get here? Why are they suggesting this to me? They are seeing that, especially in this era of reels, in which you can really do autoplay so quickly, you could just be really sucked in. And the more that they understand about the algorithms and how the schools should really talk to young people about how algorithms work and how autoplay works and self-regulation skills and attention span and all that kind of stuff. It's all, so hopefully that is something that social media platform companies can really consider, an educational department, social media literacy department, on top of the psychological well-being.
I wanted to just, we still have a bunch more questions, but I did want to just follow up on something that Jeff said, which was to, ask your sources about who their funding sources are. And I know that, Jean, you are receiving funding from one party in this big lawsuit, the attorneys general. And I would ask you, what other sources other than government do you receive funding from? And the same question for you, Linda, if you don't mind, just for our audiences to know that.
I'm not sure I understand what you're asking. I don't have grant funding, if that's what you're asking. So my research tends to deal with publicly available data sets that are usually government funded, but I don't have research funding from, say, NSF or NIH myself, if that, or from a public company, public or private company. I don't have that, if that's what you're asking.
So you don't have foundation or industry or even government funding for your work?
No, I do not.
Mm-hmm. And how about you, Linda?
Yes, my work is primarily funded by NIH, and I've also been funded by Robert Wood Johnson, and also Children and Screens, Institute of Digital Media and Child Development. And also I've worked with CDC and Department of Education and Metro West Women's Fund, to do some of my community-based work. And I do have, I have no corporate funding for my research, just to get it out there. There's no corporate funding at all for the research. I have been asked to consult with all kinds of, places out there like JED Foundation. I am a, consulting expert with JED Foundation. I also was asked to talk about my research with Meta and their Instagram, well-being experts. And that was like last year. But no corporation and no platform has ever funded my research.
Thank you. Thank you very much. Let me just go back to our questions. We had one from Chantal Riley. She says, Dr. Twenge, can you talk about some of the data on boys' mental health and social media use.
So as you saw in one of the graphs, the link between social media use and depression is weaker for boys than for girls. As far as the trends over time, I didn't have those broken down by gender. It depends. The one for clinical level depression, the overall increase over time is actually just as strong for boys as it is for girls in the most recent data. For some other data sets, though, for depressive symptoms, for loneliness, for increases in sleep deprivation, those changes have been larger for girls than for boys.
And Linda, did you want to add anything on that question?
Can you repeat the question, please?
It's when you about the research about boys and I have to find it. Data on boys' mental health and social media use.
Well, one thing that's definitely overlooked is the body image issues that are happening more and more so with boys. So much of the research highlights girls and a little bit in the non-binary category. However, the issues around boys and mental health on their body image is definitely underexplored. And I hope that there's going to be more to come.
We have a general question from Micheline Duclef saying, can you say a little bit more about the rise of pornography usage with kids and how that may be affecting mental health? I don't know if that feels within anybody's territory of expertise.
I think that's definitely something to consider. I haven't done any research on that directly, but I think it's undeniable that access to pornography, especially for younger kids and teens, has increased exponentially. And so it has to be a factor that is at least considered.
I'm going to say something that's probably not very popular, but yes, youth empowerment approach, porn is actually a very important way that young people actually learn about sexual behavior. And it can be something that is a normative aspect of sexual development. Hopefully it's the good kind, the kind that's not, really, violent and sexist and all that kind of stuff. So.
We have a question from David Shapiro. He said, it seems that Dr. Shimmerman reported that more than 80% of adolescents find social media use a positive in their socialization, but the concern is over the 23% who find it harmful. These numbers don't jibe. What have I mixed up?
Well, it's because both of them could actually be true. So they ask all these questions about do you feel connected to other people? Do you feel like closer to other people? But also, do you sometimes feel worse about yourself? So it's not like this standalone, yes, no, mutually exclusive kind of categories. And so that's why those numbers, it's not like those people are all in separate categories. You can actually say yes to both extremes of very positive use and negative use.
I mean,
there's another piece that's interesting is in the Facebook papers that Jeff helped publicize. When they ran focus groups, Meta found themselves that most teen girls said that they believed that the rise in anxiety and depression over time was due to social media, and they said that reaction was unprompted and consistent across all groups.
That does sound to me like a direct quote.
It is. You did your job well, Jeff.
I also just wanted to mention that qualitative research, based on very small sample sizes, can't really talk about prevalence in society. And so these are particular experiences of a curated, convenient sample of young people. So I just wanted to put out there too.
And that is true of those focus groups that they did. However, the data on the increases in anxiety and depression and self-harm and suicide over time are nationally representative and are not convenient samples. And so are the ones that are the correlational data.
This was a comment that, again, I think part of the pushback on the Facebook file stuff was interesting in that there were, I think, a lot of comments internally that are cited in the AG lawsuit that sort of don't match the pushback. But in addition to the qualitative stuff, which is obviously small scale because you're talking about individuals, you're talking, you know, one by one, there were also surveys of users that were conducted on, I want to say 180,000 users that broadly found that, you know, teenagers reporting that they did not consider their usage of Instagram to be, you know, they believe that Instagram usage was not good on a body image front. And again, like, I think I you know, if there's anything that I would want someone to take away from this thing, it's that connecting with your friends online is probably an unmitigated good. There's no question about that. But there are so many different ways you can do that. There are a lot of different platforms. Like the feeling closer to the people who care about you and to your peers is clearly valuable. But the weird thing is the idea that there is a sort of needs to be some sort of trade-off in which the exact current set of features of the dominant platforms, you know, must be accepted in exchange for this is how kids communicate these days, right? As opposed to that perhaps certain design features are perhaps better than others. I mean, like, Jane, I don't think, you know, you would say, and correct me if I'm wrong here, that social media is an inherent ill, you know, or that there aren't healthy ways to use it or positive, you know, sources, right? This is a question of design, construction, etc. Or am I wrong there?
Well, yeah, I mean, certainly there can be some positive ways to use it, but those design features kind of conspire against using it in a healthy way, and that's one of the problems. And you know, the other qualification I would put on that is that I think it also depends on whether you're an adult or whether you're 10 years old.
And on, by the way, on the papers, these are now fully public. If you want to go to FB Archive, which is hosted by Harvard, and go through and look at this research, that's now available. And you know, I would highly, highly recommend it for anyone. Like, bluntly, there's plenty of good documents in there that I've never cited, that no one's ever cited, and to some degree, there's a lot of like good fresh material. One thing I would really point anyone toward is just the focus on engagement. I think it's worth keeping in mind that there was a single driving factor in sort of the development of most of these features. It was not, you know, well-being work. It was engagement, right? So maximizing usage. So, you know, that's not to say that there isn't a correlation between, you know, people liking a product and using it more, but the question would be, at what point does that perhaps stop? And also, what are the trade-offs the company's willing to make in relation to that? So I think, you know, because yeah, like body image issues have always been around. You know, these are not new, and nor are they, you know, like whether something is the primary cause of it is, I mean, I think Jane, you gave a very compelling presentation. That's out of my category, right? I don't have the capacity to make that analysis. What I can say is that internally and in these documents that are available, you do see some sort of direct trade-offs being made between engagement and perhaps some of these more amorphous well-being issues.
We've gone a little over, and I want to thank our speakers both for just the generosity of their time and expertise, and also just this really respectful conversation where I want to acknowledge we're really seeing a pretty big diversity of views, some really different takes on this and how we go forward. I want to maybe close with a final question from the audience and add a little tweak to it that reflects the differing views on this. Tom Cuddy says, which country nation is doing the best job of managing and regulating the use of social media among their youth, and how? And I also want to channel over to Linda something that she said in an earlier conversation we had, where she said that Jean's recommendation that kids just, you know, be banned from social media under a certain age is unrealistic. So I guess for Jean and Jeff, I'm interested in your thoughts on the regulatory climate, and for Linda, you might be advocating something different. I don't know. So just wanted to open that up as a final question, and I don't know who wants to start first, but I hope we can hear from all of you and then close off our time together.
I'm sure I guess I would say that, and this isn't necessarily even a criticism, but in terms of who's doing the best job of regulating, it certainly isn't the US because we haven't. Right. Now, obviously, there's a lot going on in the UK. In France, there are efforts to raise age. And then Europe, definitely the Digital Services Act has some components here that are also relevant. I think in terms of age gating, there definitely are ways, and this is actually, interestingly enough, something that Meta has come out and said it fully supports, which is that I think Linda's totally right that trying to keep kids off of the platforms as they currently are is sort of a doomed endeavor. That said, what one certainly could do, and this is Meta's actually come out in favor of this, is that perhaps devices, when they are purchased, generally by parents for kids, could have ages associated with them. That would be something that would, without getting into sort of some of the privacy traps, that I think some of the US laws, state laws have come up with, would potentially allow for some level of control. And again, it would be whoever buys the device gets to determine what age range that device is appropriate for. But that's that's kind of bubbling up in a number of places. Anyhow, no strong positions, obviously, as to which jurisdiction is doing this best.
And Jean and Linda, did you want to tackle this question?
Go ahead, Linda.
I think that we are going backwards in time, wanting to be in a time machine and say, oh, we made all these mistakes, and now we want to kind of imagine a time when we can actually control people on the age that they get onto social media. And so that ship has sailed in my mind, and there's so many ways that young people can hack the system to like get on it whenever they want. And I'd say that my best case scenario for how to really protect youth well-being, which is really the whole point of my lab, is youth well-being, is to not incentivize content to young people that is harmful. And so that would mean the advertisers, the marketers, the social media platform companies, everybody would focus on educational material for people who are young, and they can be the age that they're supposed to be and not lie about their age to circumvent some kind of rule for them not to be on it. And so the content would be a lot more age appropriate if people actually knew the real age, as opposed to now where there's a lot of proliferation of fake ages. So that would be my suggestion.
Yeah, I mean, that's clear. Because all you have to do is check a box or lie about your birthday, and then you can be on. That's exactly why we need better age verification, whether that's done through the device or through some kind of third-party app to verify age. But it needs to be done, because right now it's a complete free-for-all, and there are very young kids who are getting on social media and their parents have absolutely no idea. And these platforms were not designed for kids or teens.
On that point, I think there have been, and this is something that kind of almost emerged when the Instagram for Kids thing briefly poked its head up and was smacked down. I think it's a very good question to ask. Why is content recommended by the exact same system with the same weightings and same algorithm to 13-year-olds that it is to me? That is a somewhat odd thing that perhaps if you were thinking about this from designing from scratch, I don't know that you would say that looks like what Linda is suggesting happen. And I think there are some really interesting, potentially technical approaches that could be done on some of that stuff. But that would be, I think, currently frontier territory for pretty much every platform.
Well, I want to thank our three speakers for this really invigorating conversation with a lot of different perspectives. I want to thank the audience for all their great questions. I'm sorry we could not get to all of them. I would also like to thank the team working behind the scenes to produce this webinar. Thanks to the Center for Health Journalism contributing editor, Fran Smith, Center content editor, Ryan White, and communication strategist, Abs Mandar Bishu. We'll be emailing you a survey asking for your feedback on today's program and for your ideas and other topics of interest. Please take a moment to complete it. And we also urge you to help support these webinars. You can find more information here on how to do that. I want to wish you all a happy holiday season. We will be archiving this webinar a little later today at centerforhealthjournalism.org. Thank you for joining us and have a wonderful day.
Thank you.
Thank you.
Thank you.